Pass. My name is Asmara Gebre, and I'm a midwife in San Francisco. I work at San Francisco General Hosiptal usually, and on July 8th, I was leaving work and I noticed 6 sheriff deputies following a Black person and harassing the individual to leave the premise. The person repeatedly kept asking for their EBT card and their phone charger, and obviously was displaying signs of mental health instability. And the officers continued to tell the person to leave very aggressively, also disclose their COVID positive status publicly, and were informing me that I needed to leave. Eventually were laughing at me and walked away from me and another person who both identify as Black, leaving us with the person that they required 6 officers to leave, and told me, it seems like you know it all. You should be able to handle this, and walked away. To this date, I don't know the name of the officers, but that day I wrote a public letter to our hospital administration in our city that I was on a sick strike because I'm sick of their racism and targeting of Black people. In the last year, there's been over 100 cases of force by the sheriffs, and 70% of them have been towards Black people. Our emergency department has on high ends a traffic volume of Black people that is 24%. So as you can note, that is a disproportionate amount of harm happening to our Black community. And additionally, through my years of experience at the General, I've witnessed other forms of harm from sheriffs, including headlocking Black individual who was asking to be released and saying they couldn't breathe, to creating a physical barrier from them entering a person's room who was in labor on a false call from a nurse reporting harm or fear of safety, when many people, all people of color present, denied that occurring. So that's just kind of a really overall summary of just some of the pieces of my current status on demanding that the sheriffs be removed from the hospital setting. Less than 1% of hospitals in the nation use police as primary security, and why is it that our only sanctuary hospital in San Francisco utilizes such a force that causes harm? So thank you for inviting me to this space, and I look forward to the conversation.